Hello, I'm Dr. Amir, your online health physician. Today we will discuss a condition called hepatitis. Before we start our session, kindly subscribe to the channel and share. Doctor, what is hepatitis?
Hepatitis is an inflammation of the liver, often caused by viral infections, hepatitis A, B, C, but can also result from alcohol consumption, toxins, or autoimmune disorders.
Doctor, what is the function of the liver? The liver serves crucial functions in the body, including detoxifying harmful substances, metabolizing nutrients, and storing glycogen. It produces bile for digestion, regulates blood sugar levels, and synthesizes proteins necessary for blood clotting and immune function. Additionally, the liver helps process and eliminate drugs and toxins from the bloodstream. Doctor, what are the types of hepatitis and what is the difference? There are 5 main types of hepatitis. 1.
Hepatitis A, HIV, transmitted through contaminated food or water.
2. Hepatitis B, HBV, spreads through infected blood, sexual contact, or from mother to child during childbirth. 3.
Hepatitis C, HCV, primarily transmitted through infected blood, often associated with drug use or medical procedures.
4.
Hepatitis D, HDV, requires HBV for co-infection.
5.
Hepatitis E, HEV, usually transmitted through contaminated water and food.
Doctor, why did hepatitis A happen? Hepatitis A occurs when a person comes into contact with the hepatitis A virus, HIV, through contaminated food, water, or objects. It is commonly transmitted in areas with poor sanitation and hygiene practices. The virus affects the liver, leading to inflammation and symptoms like fatigue, jaundice, and abdominal pain. Vaccination provides effective prevention against HIV. Doctor, why did hepatitis B happen? Hepatitis B is caused by the hepatitis B virus, HBV, which is transmitted through contact with infected blood and body fluids, or from mother to child during childbirth. It can also spread through unprotected sexual contact and sharing of needles. HBV attacks the liver, leading to inflammation, liver damage, and potentially chronic infection. Vaccination is essential for prevention. Doctor, why did hepatitis C happen? Hepatitis C is caused by the hepatitis C virus, HCV, and is primarily transmitted through exposure to infected blood. This can occur through sharing needles or other equipment for drug use, receiving contaminated blood transfusions or organ transplants, or less commonly through sexual transmission. Unsafe medical procedures and needle stick injuries are also potential sources of infection. Doctor, why did hepatitis D happen? Hepatitis D, also known as delta hepatitis, occurs when a person is co-infected with the hepatitis B virus, HBV, or becomes infected with HBV and then subsequently contracts the hepatitis D virus. HDV is dependent on HBV for its replication, and the combination of both viruses can lead to more severe liver damage than HBV infection alone. HDV transmission can occur through similar routes as HBV, such as exposure to infected blood or sexual contact. Vaccination against HBV helps prevent HDV infection. Doctor, why did hepatitis E happen? Hepatitis E is caused by the hepatitis E virus, HEV, and is mainly transmitted through contaminated water or food. Poor sanitation and inadequate hygiene practices contribute to its spread, particularly in developing countries. While it is usually a self-limiting infection, it can be severe in pregnant women, leading to an increased risk of mortality. Doctor, which hepatitis is most common in the world? Hepatitis B is considered the most common type of viral hepatitis worldwide. It affects millions of people and is prevalent in many regions, particularly in sub-Saharan Africa, parts of Asia, the Pacific Islands, and the Amazon basin. Chronic hepatitis B infections can lead to severe liver diseases, including cirrhosis and liver cancer. Doctor, why is hepatitis B so dangerous? Hepatitis B is dangerous because it can lead to chronic infection in a significant number of cases, causing long-term liver damage, cirrhosis, and an increased risk of liver cancer. It is a major global health concern due to its high prevalence, potential for transmission through various routes, and the severity of its complications. Doctor, what are the signs and symptoms of hepatitis B? The signs and symptoms of hepatitis B can vary and may include fatigue, abdominal pain, loss of appetite, nausea, vomiting, joint pain, and jaundice, yellowing of the skin and eyes. Some individuals may have no symptoms initially. Chronic infection can lead to more severe symptoms and long-term liver damage, including cirrhosis and liver cancer. How do you assess patients for hepatitis? To assess a patient for hepatitis, a healthcare provider conducts a comprehensive evaluation. This includes taking a detailed medical history, physical examination, and ordering specific blood tests to detect viral markers, liver function, and evidence of liver damage. Additional imaging studies or liver biopsies may be performed to further evaluate the extent of liver involvement. Doctor, does hepatitis affect pregnancy? Yes, hepatitis can affect pregnancy. Hepatitis B and C can be transmitted from mother to baby during childbirth, leading to chronic infections in the newborn. Hepatitis E can cause severe complications in pregnant women, increasing the risk of mortality. Proper management and prenatal care are crucial for pregnant women with hepatitis. Doctor, does hepatitis affect diabetic patients? Yes, hepatitis can affect diabetic patients. It can cause fluctuations in blood glucose levels and worsen diabetes control. Chronic hepatitis can also lead to liver complications, which may impact the metabolism and clearance of medications used to manage diabetes. Proper monitoring and management are essential for diabetic patients with hepatitis. Doctor, what is jaundice? Jaundice is a medical condition characterized by yellowing of the skin and whites of the eyes due to an excess of bilirubin in the bloodstream. Bilirubin is a yellow pigment produced during the breakdown of red blood cells. Jaundice can be a symptom of various liver, gallbladder, or blood disorders. Doctor, does jaundice indicate hepatitis? Yes, jaundice can be an indication of hepatitis.
Hepatitis is inflammation of the liver, and certain types of viral hepatitis, such as hepatitis A, B, and C, can cause jaundice as one of their symptoms.
However, jaundice can also be caused by other liver-related conditions or factors, so further evaluation is necessary for an accurate diagnosis. Doctor, what is liver function test LFT? Liver function test, LFT, is a group of blood tests used to assess the health and functioning of the liver. It includes various parameters such as liver enzymes, ALT, AST, ALP, bilirubin levels, albumin, and total protein. LFTs help diagnose liver diseases and monitor their progression or response to treatment. Doctor, can mother breastfeed with hepatitis? In most cases, a mother with hepatitis can breastfeed her baby without any risk of transmission. However, if the mother has hepatitis B, the baby should receive the hepatitis B vaccine and immune globulin soon after birth to reduce the risk of transmission. It's best to consult a healthcare professional for individualized advice. Doctor, what precautions should we take for hepatitis? To prevent hepatitis, here are following precautions. Get vaccinated for hepatitis A and B. Practice safe sex and use barrier protection. Avoid sharing personal items like razors or toothbrushes. Avoid using illicit drugs or ensure sterile needles. Practice good hygiene, including hand washing. Be cautious with blood products or medical procedures. Avoid consuming contaminated food or water. Be aware of hepatitis risks during travel. Thank you, Dr. Amir. It was wonderful knowledge shared for everyone. Wish to see you with another health topic. Goodbye. Please share your comments and subscribe to the channel for upcoming health videos.